Hello, and thank you for watching our presentation. Today we will be talking about amyotrophic lateral sclerosis, or ALS. First of all, what is ALS? The first documentation of ALS was recorded in 1869 by Jean-Martin Charcot, a French neurologist. However, the disease did not receive much attention until 1939, when the New York Yankees first baseman, Lou Gehrig, was diagnosed with ALS and retired from baseball. Since that time, the disease is commonly referred to as Lou Gehrig's disease. ALS is a progressive neurological disease that affects nerve cells or motor neurons in the brain, the brainstem, and the spinal cord. The motor neurons gradually degenerate and eventually die. Without the motor neurons, the brain and spinal cord are no longer able to send messages to the muscles in the body. Without these signals from the brain and spinal cord, the muscles cease to function and gradually waste away and begin to twitch. It is important to note that ALS affects the voluntary muscles, or in other words, the muscles used to walk, move your arms, to breathe, etc. It does not affect involuntary muscle movement, so the heart and digestive system are left unaffected. Since ALS attacks the motor neurons, it is commonly believed that it does not affect a person's mind. However, recent studies have found that as many as 1/3 of individuals with ALS show clinically significant cognitive impairments in the frontal lobe. The senses such as sight, hearing, taste, touch, and smell remain intact. Even though ALS affects the voluntary muscles, it does not affect the muscles of the eye and bladder in most cases. Early symptoms for ALS vary per individual. The most common symptoms include increasing muscle weakness and stiffness. This is most notable in the arms and legs, but is also present in the muscles used for speaking, swallowing, and breathing. Other symptoms include muscle twitching and cramping, and thick speech characterized by difficulty to project one's voice. The disease most often occurs in individuals between the ages of 40 and 70. Once diagnosed, life expectancy is between 2 to 5 years. However, in some cases, patients have lived upwards of 20 years after diagnosis. ALS is not contagious and the cause is unknown. As of now, there is no cure.
So how does ALS affect voice? ALS affects a person's ability to speak loudly and clearly. Eventually, it will prevent the person from being able to speak and vocalize. 25% of all ALS cases begin with weakness in the muscles involved in speech. Clinically, the symptoms are separated into two areas: spinal functions and bulbar functions. Spinal functions include weakness in the upper and/or lower extremities. Bulbar functions include weakness with changes in both speech and swallowing. Individuals may initially present with symptoms associated with spinal functions. However, as the disease progresses, bulbar functions are usually affected. Individuals with ALS usually experience mixed dysarthria, which is a mix of spastic and flaccid dysarthria. Here is a list of symptoms that an individual with ALS may present with: imprecise consonants, hypernasality, harsh voice, low pitch, reduced stress, strained, strangled voice quality, audible inspiration, and nasal emission. ALS is often separated into 5 stages. Stage 1, there is no detectable speech disorder. The diagnosis has been made, but often those with spinal presentation do not experience problems with speech right away. During this stage, SLPs attempt to address respiratory, phonatory, and resonant support for speech. Stage 2, obvious speech disorder with intelligible speech. Both the speaker and the listener have noticed changes in the speech. Speakers may feel they need to exert more effort to produce speech. Also during this stage, the SLP attempts to address respiratory, phonatory, and resonant support for speech. Stage 3, reduction in speech intelligibility. There are often changes in the individual's speaking rate, articulation, and resonance. Stage 4, natural speech is supplemented. Natural speech is no longer a functional way to communicate in all settings. Stage 5, no functional speech. Advanced bulbar ALS leaves the individual unable to functionally communicate due to profound weakness. Now that we have talked about how ALS affects voice, what are the treatments for ALS? There is no cure for ALS. All treatment is compensatory. Drugs are often used to treat symptoms of ALS. Direct speech intervention is not recommended. Other treatments include behavioral interventions, environmental interventions, prosthodontic intervention, and the use of augmentative and alternative communication devices, also known as AAC devices. Behavioral interventions include increasing the rate of speech using a metronome as an example, taking more frequent breaths, developing a high front voice focus, conserving energy for communication, and the elimination of oral and speech drills. This is because exercise to fatigue may speed up neurological deterioration, and drills may be so tiring that it could compromise functional speech in other settings. Environmental interventions include making sure the listener is in the ideal position to hear the speaker. This is done by facing each other and reducing the amount of space between the listener and speaker. You can also reduce background noise by turning off the TV, radio, and other electronic devices. Prosthodontic interventions include the palatal lift, usually made for individuals who present with weak or spastic velar function. This allows velopharyngeal closure that is adequate for voice, speech, and swallow, but still allows nasal breathing. When a person loses control of their voluntary muscles, which includes the muscles for voice, an AAC device can be used to facilitate communication. Often individuals with ALS will store word banks or sentences in their AAC devices so that when they can no longer speak, the AAC device plays audio samples of their own voice. There are a large variety of AAC devices ranging from low-tech methods such as whiteboards to high-tech methods such as electronic devices to imitate and supplement speech. AAC devices allow those with ALS to communicate through modified means of speech and communication. Now we are going to watch a video about Augie Nieto, a man with ALS, and how he uses his AAC device through eye tracking software to communicate.
ALS presents many challenges, but communication is the most overwhelming. When the ability to communicate is lost, hope often goes along with it. Not only do you lose your voice, in a sense, you lose your identity. When I was diagnosed with ALS almost 4 years ago, I knew that I didn't want that to happen. And when I was starting to find it harder to move my hands, I started to explore software and hardware solutions that might help me stay connected with my friends, family and business colleagues. Today I stay connected with my eyes. Eye tracking technology used to be confined to university research, but thanks to Dynavox, it is now real technology that solves real problems. With my eyes, I can speak, send email, control my environment, TV, DVD, etc. with infrared controls, use the internet and read books. This device has given me the power of hope. More than 90% of people diagnosed with ALS lose the will to live and elect not to go on a ventilator because they cannot communicate. It is frustrating because although my body may not function in the manner that I want it to, my mind is sharper than ever. The VMAX and IMAX give me the ability to connect with others again. As you can imagine, this is extremely powerful and has given me the ability and will to live.
Now that we've learned how ALS can affect one's voice, let's take a look at how it can affect swallowing.
How does ALS affect swallowing? Breathing or swallowing muscles may be the first muscles affected. As the disease gets worse, more muscle groups develop problems. The symptoms include difficulty breathing and swallowing, aspiration, easily choking on food or drink, drooling, and gagging. Weak tongue or cheek muscles can make chewing difficult and therefore make swallowing difficult. An increased risk of choking means that people with ALS may not be able to eat normally, ultimately resulting in difficulty maintaining weight. What does intervention look like? Because there is no cure for ALS, all intervention is compensatory. Swallowing tips. Those in the early stages of ALS can manage problems with chewing and swallowing by eating carefully. Here are a few strategies for safer swallowing. 1. Have the patient sit upright during meals. 2. Eliminate distractions and concentrate on a slow, steady rate of eating. 3. Clear the mouth of any excessive secretions or saliva prior to eating. 4. Take smaller bites. 5. Keep the chin slightly tucked to prevent opening the airway too much. 6. Swallow 2 or 3 times to clear the throat in between eating. 7. Alternate swallowing food and liquids. 8. Moisten foods with gravy or sauces. When swallowing problems begin to occur, it may be necessary to make dietary changes to make swallowing easier. For those in the middle to late stages of ALS, A feeding tube may be necessary to make sure nutrition is being received in the body and that proper weight is maintained. A feeding tube will also help avoid choking hazards.
We hope that this presentation has helped you to understand the severity of ALS and how it affects a patient's life. For more information on how voice and swallowing are affected by ALS and suggested intervention strategies, please see the sources listed on your screen.